Hi, I'm going to talk a little bit about a breakthrough drug for postpartum depression. Postpartum depression, 10 to 20% of all women who deliver a child, within 6 weeks after delivering a baby, they become depressed. What happens during pregnancy, usually leading up to the third trimester, the level of progesterone in a woman increases dramatically. So the body gets used to a large amount of progesterone, which makes you feel up or feel good. Then it drops dramatically when the baby's born. So within hours of the baby being born, it could go from thousands to under 100. So that causes a depression in some women, 10 to 20%. And this is a problem because this is when the mother needs to bond with the baby. This is when she's caring for a helpless infant, and the baby could be in jeopardy. The mother could hurt herself. It's a very bad situation. There is a breakthrough drug called Zulresso, Brexanolone. Brexanolone came out about a year ago, and it's the first drug in its class, a neuropeptide, that treats depression. What is this drug? Basically, it's aqueous or Brexanolone in solution, in a water solution, and it is a metabolite of progesterone. So they've taken the breakdown product of progesterone, they've Brexanolone, and they've put it into a solution so it could be administered to a woman who's depressed. This is a miracle product. Within 2.5 days, you take this, your depression lifts. It's a miracle product. There's nothing like it. It's a scientific breakthrough. They've never had a progesterone-like drug that you could take to treat depression. And it works faster than any known antidepressant. And it works in women who've just delivered a baby. So that's the good news. Now, what is some of the disadvantages of this drug? Well, we know it works, and it works great, and it works quickly. Okay, that's good. I've had some problems using it because, let's go through the big one. You can only use it with an IV infusion. Okay, that's one. So that means you have to start an IV into someone's vein and shoot the fluid into someone's vein. That's good. Now, it only can be used in a hospital. Why is that? Well, once you give this, people could lose consciousness. They could stop breathing. They could become very faint, dizzy. You have to check on them in a medical type facility every 2 hours because they could stop breathing. They can't be in charge of their baby because they're in and out of consciousness, or they could pass out. So that's a big problem. It can only be given in a hospital. Advantage number 3, they stop breathing. So if you stop breathing, we have to make sure they stop breathing by checking on them, but also with an O2 oximeter. So you monitor when they're in the hospital, their oxygen content. That's another big disadvantage. They stop breathing, you have to intubate them, give them oxygen with a BiPAP or a CPAP machine. So that's advantage number 3. One is you have to give it IV. 2, you have to monitor them in a hospital. They have to be monitored every hour. 3 is their O2 saturation needs to be monitored because they could stop breathing. Number 4, well, it's kind of pricey. It's $34,000 for the full treatment. So that's just for the hospital. That's just for the drug. The hospital's extra. Let's give that another $3,000. Who's going to watch the baby? Because this woman can't be trusted to watch the baby. So you need someone to watch the baby. You need to pay for the hospital and pay $34,000 for the drug. So it's very expensive. So the disadvantages, you have to give an IV infusion. I think it's like 90 micrograms per kilogram per hour for 60 hours, 2.5 days. So that's one disadvantage. 2, you can only give it in a hospital where someone's watched every 2 hours by trained staff. 3, they may stop breathing, they may pass out. and their level of consciousness is fleeting. And 4, it's very expensive. So needless to say, this drug is not used that much. Even though it's an amazing product, it works in 60 hours, it treats postpartum depression, it's a neuropeptide, it's a first in class for the treatment of depression. It's got some serious drawbacks because remember, the other antidepressants work pretty well. You could use an Effexor, venlafaxine, desvenlafaxine, bupropion, use it, potentiate it with antipsychotics like Abilify to speed up the process of the treatment of depression, probably within a week. This one works in 2.5 days. Okay, but you see my issues with it. Although I'm very impressed with the drug. I'm very impressed with what it does. And it's a novel compound. It's the beginning of research in this area. You know, some research on this Brexanolone is it affects the 5-HT3 serotonergic receptor. It hits the nicotinic acetylcholine receptor. It also affects the GABA receptor. It potentiates action at the GABA receptor. So it does a lot, and it is very impressive, and I'm very impressed with this drug. But as for its practical uses, not so much. This is Dr. Mark Agresti. Please subscribe to my channel. I could use a comment. Give me a like. I really appreciate it. If you want to hear more, go to Amazon.com and look for my book, Tales from the Couch. Thank you.